For the first time, we are seeing exactly just how crowded our local hospitals are. Federal data says that 5 Valley hospitals were at capacity just last week. The I-Team's David Charnes is in our newsroom tonight, and he's here with some of those new numbers for us. David?
Yeah, Denise, this data is for the week between Christmas and New Year's. It shows 5 of our local hospitals here in the Valley were at or above their ICU capacity, with COVID, of course, playing a big role here. Overall, ICUs here in Southern Nevada nearly 80% full right now, with about half filled with patients battling COVID. Members of the state's COVID-19 task force say there are no immediate plans to expand any hospital beds on an emergency basis here in our area. Now, this chart here, I want to show it to you because it is from the Nevada Hospital Association, and it shows our trend for the number of people in the hospital. You see in all those lines there, it doesn't really matter which one you look at, but there's a slight dip. And then there's what we saw last week, the dip there, and then it sort of varies a bit, sort of stays at the same level for a couple of weeks. All hospitals are required to report how many people are in their ICUs to the federal government. Spring Valley, Summerlin, Sunrise, North Vista, and Henderson all at or above ICU capacity from last week. It does mean that there are more people for the number of beds they have, but clearly they are able to treat all those people. The state's COVID task force and local hospital leaders stressing they are and will be able to handle a surge, as Denise just mentioned, if need be. Now, these ICU numbers are also total capacity. We're not just talking COVID patients. Of course, people are sick for other reasons. Those COVID patients making up about half of beds filled on average. We also want to emphasize that busy hospitals aren't a reason for staying away from the hospital. Of course, in an emergency, please go there. These figures we're bringing you here are from the University of Minnesota COVID-19 hospitalization tracking project and data reported to the government. The Nevada Hospital Association does not release these specific hospital data like we just showed you, but it hasn't told us why. Live in the newsroom tonight, I'm David Charnes, 8 News Now.